Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to Dr. Letitia Jaraza, the Baltimore City Health Commissioner, about a variety of innovative approaches underway to combat COVID-19. We speak about the city's unique public-private partnership, mobile testing, a hotel converted to care for people in isolation and quarantine, and a new corps of community health workers for contact tracing and other critical functions. Let's listen. Dr. Jaraza, thanks so much for joining me. You lead the Baltimore City Health Department, which has been involved in some very interesting and innovative responses to COVID. I'd love to give you a chance to talk about them. Where would you start?
I'd actually like to start with the public-private partnership that we formed towards the end of March. So a couple weeks into our response, we were approached by University of Maryland Medical Systems, Johns Hopkins Health System, as well as CareFirst, which is one of the largest insurers in the Mid-Atlantic region, to form this public-private partnership to really augment the city's response around COVID-19. And I think though we had partnerships with these groups in the past, this particular, more solidified partnership, I think really helped to propel how we've been able to respond to COVID-19. So as a part of that group, we actually created a few different work streams. One of them was around testing. One of them was around data and data presentation, as well as vulnerable populations, communications to the community, and care coordination, as well as a call center.
Tell me about the call center.
So the call center actually had already been partially set up by CareFirst, but it was intended to be a line that folks who might not have a primary care provider could call into and either be referred for testing or have medical questions answered. And it was supported by physicians on the back end at Maryland as well as Hopkins. Again, just providing that additional support for folks who, again, might not have a provider or might not have access to the healthcare system.
And do you have any sense how many people called roughly?
Oh, that's a great question. It actually, the volume never got particularly high. So I don't think there was ever a day where there were more than 100, 120 calls per day. We've since transitioned to a Baltimore City Health Department run call center that helps with resulting, as well as providing, again, that additional medical guidance. We shared the information on the call center and messaged it and worked also with 211 to ensure that folks would call in. But I get the sense that a lot of people did end up calling their primary care provider. But again, I think it was a great resource for those who didn't have one.
It was really a safety net.
Exactly.
So what other safety nets have you been able to set up in the city?
I think one of the big ones has been our Triage, Respite, and Isolation Center, which is housed in the Lord Baltimore Hotel. So again, very early on in the response, we were challenged by residents in the city who were unstably housed. They might show up in the emergency department and get tested and might not have someplace safe to go so that they could isolate. And so, we began working with the Mayor's Office of Homeless Services, as well as Healthcare for the Homeless, and Hopkins to create a process where those individuals could be referred to a hotel. And so initially we had some hotels in Baltimore County, and it was challenging because they were outside of our jurisdiction. And, we had a whole protocol and process by which we got folks there, but recognized that there was a need for additional medical support and a lot of care coordination support. So having them within the city would make our job a bit easier. So we actually, in the end of April, worked with University of Maryland Medical System as a part of our public-private partnership to secure a hotel in the city, downtown, that is very easily accessible, that we transition those residents to pretty seamlessly using our transportation vendor, still working with Healthcare for the Homeless, still working now with the University of Maryland Medical System to provide that care coordination and medical support.
So take me inside the Lord Baltimore Hotel. What's it like there now?
Well, first of all, I want to say it's a beautiful hotel. It's a historic hotel. And I talk about the public-private partnership with our healthcare supporters. But again, this is an opportunity we could not have had without the gracious support of the hotel owner. So I definitely commend them for being open enough to take in unsafely housed residents. In the beginning, it was challenging to find a hotel that would do that. But you come in, you sign in, you get your temperature screening. We've separated hot and cold floors. There's an area for donning and doffing of PPE on each floor, as well as someone who observes you doing that. Additionally, we have nurse practitioners who support by doing rounds on the patients at least twice a day, and nurses who support by checking vitals. We also provide meals, as well as allow for folks to wash clothes or have access to services throughout the hotel.
So what's a hot floor and what's a cold floor?
Sure. So our hot floor are those individuals who've tested positive and need a place to safely isolate. Our cold floors might be those that are still awaiting results, but still, again, need to quarantine away from others.
They may be living with someone who has coronavirus, and exactly. you want to make sure that their risk is low as possible.
Yep.
And are you able to get other services for people while they're in this sort of way station?
Yeah. So this goes back to some of the care coordination needs. So again, early on, we saw that individuals might need their methadone or buprenorphine delivered. So that was a service we provided even at the outside hotels before we came to Lord Baltimore, and we continue to provide that service.
That's treatment for opioid use disorder.
Yep. So we continue to connect people to peer recovery specialists if that's a request or if that's a need. And again, we don't discharge anyone who doesn't have someplace to go after they leave. So again, working with the Mayor's Office of Homeless Services to ensure appropriate housing discharge disposition too is very important to the work we're doing there.
I think I know the answer to this question, but before this crisis, did you have a team ready to go to set a place like this up?
We did not. So there has been a lot of learning as we go, but the team has been phenomenal. So the primary team that we have supporting it is actually our team that does our mobile spot van and provides treatment for those living throughout the city and prescribes buprenorphine to those folks. So this is a team who really had worked very closely with this population, but again, none of us had ever set up a triage, respite, and isolation center. So they really have been great at setting it up and providing residents with the services that they need.
It sounds like you have been able to leverage the institutions like the University of Maryland, Johns Hopkins, Care First, to be aligned with where you think the critical public health needs are.
We have. I think we've been very, very fortunate to see our two large academic institutions come together and realize that we're all in this response together, that it isn't one hospital or it isn't just the city who's providing the response. It really is all of us. And those are just two of the hospital partners. We've certainly had other hospital partners. LifeBridge comes to mind. They actually supported our very first city-supported testing site. It was in partnership with them. And we've also worked very closely with our federally qualified health centers on testing initiatives too. So I can't thank other partners throughout the city enough for recognizing that this has to be a citywide response in order for us to effectively handle the pandemic.
So tell me a little more about testing.
Yeah, so testing for us really started off as we knew that there was this need, and we specifically wanted to target our more vulnerable populations. Initially, there was a lot of testing in our hospitals, but not so much outside of the hospitals. And so that was another gap that we wanted to fill, at recognizing that we had limited staff to do it, but that we had great hospital partners through the public-private partnership to set up a testing site. So back in April, one of our partners, our hospital partners, LifeBridge, was was already doing some testing near their hospital. And it was usually LifeBridge patients, but they were open and receptive to partnering with the city to bring in other residents who might need testing as well, especially folks that might be in that area. So we partnered with them back in April to set up testing at Pimlico, which is actually a racetrack in Baltimore City, but has a huge kind of parking lot and space for folks to drive through and get tested.
Where the Preakness is
Where the Preakness is, yep. So we started testing there back in April. And actually that was at one area where we used our call center to direct residents for testing. And at that time, we were able to do maybe 120, 150 tests per day. And subsequently, as we saw our capacity expand and our access to test kits expand, we recognized that would be a great site for high throughput testing. So about a month ago, we actually converted that site to a high throughput testing site, which can do upwards of 500 tests per day when they're testing.
Got it. Now, I've been also hearing about mobile testing in Baltimore.
Yeah, mobile testing has been another huge part of our strategy. So we started off again at Pimlico as the stationary testing site, but recognize that a lot of the people we serve access to cars and don't have access to the healthcare system. So that site did require an appointment. So we wanted to really create a low barrier testing system. And that was where mobile testing originated. So we started mobile testing, again, that was probably back in early May. And we used the data about where we were seeing high prevalence rates of disease, as well as, again, understanding where there was very little access to healthcare, and where we had community partners who could help with getting the right folks to the testing sites. So we started doing mobile testing at the time in 21224, which was one of the zip codes that was heavily impacted and still remains pretty heavily impacted, working with a church partner there, and subsequently brought in a federally qualified health center that serves that community as well to support mobile testing. We also looked in the South Baltimore region, which traditionally also has pretty low access to healthcare, and partnered with an FQHC there, Family Health Centers Baltimore, to provide mobile testing a few days a week.
So the mobile testing, it's not like a van that goes around and tests people. It's more like you found community locations where that people trust, and then you partner with the people who run those locations, and the city health department shows up and does the tests.
Yeah, we actually do take our vans to those sites because that does help to house some of our supplies. But yes, it is very much, it's usually a church parking lot. Again, it could be with an FQHC in a community space. So yes, we take our staff there. No appointments required. It's walk up only. And again, I think it's been very, very well received by the community, and we've been able to test a lot of people through our mobile testing capacity.
You've been hampered a bit by the delayed testing times. Is that fair to say?
We have. Now, we did look at our results at turnaround time for the past month, and it averages between 2 to 5 days. I mean, ideally, right, we're getting results back in less than 48 hours. But we have seen where, especially when there were spikes in the South and the West, our testing time was significantly delayed. But I think we're starting to see some improvement.
Now, another innovation that some people may have seen is the news of a community health corps in Baltimore. Could you explain what that is?
Sure. So the Baltimore Health Corps program, again, another great partnership. I cannot stress enough. The health department could not do any of this work alone. We rely very heavily on our partners. But we were approached by the Rockefeller Foundation to really start a very unique program that paired workforce development with public health needs, specifically the need for additional contact tracers, as well as the need for care coordination and connecting individuals in the community to resources. And so this is a partnership with Rockefeller and multiple funders across the city, as well as national funders. The Mayor's Office of Employment Development, who really has helped with the workforce development piece, and Baltimore Corps, which is a nonprofit that has helped with recruiting, as well as JPIGO, which is a global health organization out of Johns Hopkins, which has helped with training and implementation of the model, because we will ultimately hire more than 300 individuals to support contact tracing. They will be trained as community health workers. They'll support education and outreach to individuals in the communities that are most heavily impacted, as well as, again, do some care coordination through one of our partners, Healthcare Access Maryland. So huge undertaking that would not be possible without the great work of our partners.
So a lot of places are going out for contact tracing and hiring contractors to do it. You've created this program, which hopefully will hire people from inside Baltimore neighborhoods, including some people who may have just lost their jobs because of the downturn.
That is very much the goal. So when we put the program together, one of the things that we sought to design was a rubric, because we wanted to identify folks, as you mentioned, who had been affected negatively, having lost their jobs as a result of the pandemic, but also living in the communities that were most heavily impacted. So we wanted our workforce to reflect who we were serving. And so that's been, from day one, very important to how we recruit and hire.
So all these different initiatives may be one reason why Baltimore has not emerged as a major hotspot. Didn't early on, didn't midway. You're seeing a little bit of a bump in cases recently, and Baltimore's name has appeared. What do you think the critical challenges are for you moving forward to keep the impact of the pandemic at a manageable level, or even get it lower?
Yeah, I think messaging still remains a big priority and challenge. I understand that people may have some pandemic fatigue, and I understand that people may become a little bit lax in those things that we talked about early on. I understand that guidance in the beginning was confusing around wearing a mask versus not wearing a mask. And so, now we're in a place where we're asking people to really, be responsible, to wear their masks, to continue to socially distance. And some folks have been doing it for multiple months, and folks are a bit fatigued. And so messaging, I think, remains an important part of what we do. I think the pending flu season also remains another challenge as we think about what will happen this fall, and how that might impact hospital capacity and utilization. So we are very cognizant of the importance of messaging around getting a flu vaccine, but also supporting widespread flu vaccination for our city residents, especially those that are most vulnerable. I think general health department workforce fatigue is another challenge that I think people talk about some, but it's a very real thing. I have some folks on my team who have been going pretty much nonstop since this began in March, and folks are very dedicated, but people are also tired, and so making sure that we're also taking care of our healthcare workforce as well throughout this, and certainly that applies also to our healthcare workforce working on the front lines in hospitals, and the fatigue that comes with doing that work. So multiple things come to mind when I think about some challenges in the next few months.
Well, let me ask you one last question, which is, I know that in Baltimore there have been reports of high levels of viral spread in particularly Latino immigrant communities. Does that remain a concern, and what are you trying to do there?
Yeah, that still remains a concern. I think, again, we've been fortunate to have a partner, have multiple partners in the Latinx community who have helped significantly with messaging. They've helped with setting up our mobile testing sites. So where we started off with one mobile testing site in the Latinx community, we've been able to expand that through our work with Hopkins, as well as our work with Baltimore Medical System, so that we're now all able to go to different parts of the 21224 zip code and test in all of those regions. Messaging, again, becomes very, very important within that community, making sure that they recognize us as a trusted partner, that there should be no fear of repercussions or of reporting of any sort, that we want to help. We want to provide this as a resource, but then also that we're able to connect individuals in the community to appropriate support, either through our Tri-Center or assistance, so that they can support their families if someone needs to take off work.
Or food, for example.
Or food, for example. So ensuring that folks have everything they need so that they can safely isolate or quarantine and don't have to go to work or be in the community when they could be home recovering.
Well, thank you so much for taking time to explain all the incredible work that you and the rest of the team at the health department are doing right now. It's extremely important, and I wish you every measure of success for what you're doing for our city.
Thank you.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.